Assalamu alaikum warahmatullah. I am Dr. Ahmed D. Abdulwahab. I am a diagnostic and interventional radiologist working in Erbil, Razgari. Today we have a very interesting case. In fact, this case was published as a case report. So I will present it to you today, hoping to see what your opinions are about what the abnormality could be. First of all, this is a knee MRI. This is an MRI of a patient, female patient. She's 21 years old, and she was presented with pain in the left knee for a few months. X-rays showed some cortical irregularity in the knee. Unfortunately, I don't have the X-ray image, so I will just tell you about the MRI image. First of all, this is a T2 weighted fat saturated axial images of the knee joint, and we see here that this is the lateral meniscus. It looks good to me, and the ACL and the PCL, and they are all look good. And oh, what's this? What do we have here? We have this hyper intense signal on the medial aspect of the anterior aspect of the medial femoral condyle. So let's see other sequences, see what's that. This is an axial T2 weighted fat saturated or fat suppressed images of the knee joint, and you can see that there is some cortical remodeling. The cortex is basically intact, it's not invaded. However, this is not normal shape of the cortex of the bone, and you can see the lateral femoral condyle, how it's look while compared with the medial femoral condyle. And now let's see the T1 weighted images, and to see what does it look like on a T1. You can see that this thing here is causing the cortex to be indented, to remodel. However, it's not destructed, the bone underneath is intact, and there's no bone marrow signal, no bone marrow edema. And you can see that this mass is a little bit not as hypo-intense as you would expect. It's a little bit hyper intense. Okay, so let's see. After this is a T1 weighted, let me just check. This is a T1 weighted image, fat saturated, and I think it's, just give me a second. Yeah, fat saturated post contrast image, and you can see that this mass, which was little bit ISO to mildly hyper intense on T1, now it's showing intense post contrast enhancement. Okay, and it is not invading the underlying bone. Even the patella looks good to me. And let's see T1 without fat saturation. Again, you can see multiple tiny dots, let's say, within this lesion, and it's enhancing, of course. So what do you think is that? What will it be? I'm waiting for your answers. Write it in the comment section, and I'll try to reply to them. See you tomorrow, I hope. Thank you.